Hi, this is Terry Kuti, founder and director of Deep Sea Foundation. Welcome to the educational channel where we talk about all options for breast reconstruction. And we also have guests that work with breast cancer patients. And today I'm so honored to have on the program Candice Falcon with Falcon Artistry, who is a tattoo artist up in Vancouver, British Columbia. Candice, welcome to the program.
Thank you so much for having me. I'm so grateful to be here and to be able to talk to you.
Yeah. Well, we met via a patient who is on my Facebook page, and I'm really glad to be able to interview a tattoo artist up in Canada so we can get the word out to the patients up there, the availability. I would like for you to tell us where you're located, what services you provide, Candice. I want to take something off of your website, if I might, because it struck me when I was looking at it before the interview. It says facilitating healing, enhancing natural beauty. You do skin scar camouflage. You also do 3D areola restorative tattoos. You do brows for breast cancer patients. Tell us everything that you do.
Well, I kind of started out as, well, I've always been an artist and a painter, and I started out in tattooing doing cosmetic because I'm very fair and I didn't really have any brows. My lips are the same color as my skin. I just really gave some definition to my face, and it just made me feel better about myself, not having to kind of put anything on to be able to run errands or just kind of, some people have natural definition, other people don't. So it was, I liked doing cosmetic. I still do it, but I really have a passion for the restorative work because this is something that you are definitely allowed to have back, and the healing that, as I said on my website, is kind of facilitated through the tattoo is just from feeling more familiar with yourself and having better self-perception as a result. And if you can do that through a tattoo, why not? And a lot of the people that I tattoo, it is their first tattoo. And it has kind of a stigma around it, thinking like, oh, I'm getting a tattoo. But the difference it makes and the fact that it does have the permanence, it becomes part of you, and it just makes such a difference having that there. Yeah.
Well, working with breast cancer patients too, a lot is taken away from them. So how do you see the transformation when they come in to have a nipple or areola tattoo, or to have a scar covered from surgery? What transformation do you see, and how difficult is it to work with a breast cancer patient?
Well, I think the transformation is usually there's kind of low expectations coming in, thinking, like let's just see if I can get this done. It's kind of the finishing touch, and like there is usually some excitement, but also some nervousness.
Yeah.
And people do say, oh, I don't know, I want to get the nipple tattoo, but then I also have extensive scarring. So I've always said to people, like, if we do the nipple tattoo, you'll realize like you'll have such a difference in the way you perceive yourself, because your eye goes to that nipple, and it actually distracts the eye so much from the scarring. So that already makes such a difference in itself. But there is also scar camouflage available for people, whether it's light scarring or dark scarring, to blend it a little bit more with the surrounding skin. And yeah, I mean, this is it's kind of funny. Not so much during COVID, but I was getting a lot of shirtless hugs when I was doing the nipple tattooing before. I think a lot of people mostly their reaction is they're surprised how much they are convinced by the realism of the tattoo. And I guess they're surprised how much of a difference it makes, because a lot of people do comment that they don't really look in the mirror in advance of the tattoo, and they don't want to see themselves. They don't want to see the changes that have happened to their body. But once they have that tattoo, they do want to look at it. They want to see their chest more, and they feel a complete transformation, and they'll show their friends and stuff like that too. So it is a complete turnaround, usually just with a, you know, an appointment to tattoo a nipple. Yeah.
Yeah, I think what you said about patients coming in with really no expectations other than knowing they're going to get a scar covered or a nipple areola tattoo, even a patient who has chosen to stay flat and is covering her mastectomy scars, I think it does two things in my mind. It draws the eye away, it takes the mind away from the breast cancer diagnosis, but also it almost tells a story in their life. Do you find that to be true?
Oh, definitely. Yeah. And what a lot of people don't realize too is there isn't really a time limit on when you should get the tattoo by. I have quite a few clients that it's the 10-year anniversary, and this is kind of something that they're doing for themselves to signify the closing of a chapter and feeling like, okay, there isn't that threat anymore. I feel like I can move on. I feel like I can do this for myself now. And so it's so much more than just a tattoo most of the time. In one day I had a woman who, yeah, it was her 10-year anniversary. And then my next client, it had been 20 years and she had had reconstruction, but she had never had the nipple tattoo. So yeah, it was such a difference.
I celebrated my 6th anniversary just in December with a meaningful tattoo for myself. So I know I get that. I get that. And don't you work too, Candice? Aren't you a part of BRA Day, which stands for Breast Reconstruction Awareness Day in Canada?
Yes, yeah, I've been participating in it for, I believe, the past 3 years. Yeah, artists and counting, but
and plus it looked different last year with COVID. BRA Day was completely different, even in the US with COVID. There was a lot of virtual BRA days. So, but yeah, I mean, because you know what, BRA Day originated up in Canada. And I was really pleased to see that you are involved in that.
Yeah, it's such a great event. I love participating in it. I always talk to everybody about it. I try to promote it in advance. A lot of people don't know about it. Even people that have been through breast cancer. It's such an important event, just to get any general knowledge. It's so informative. And yeah, I learn a lot. I always sit in on the whole thing and listen to everything through. And it's such a great opportunity to meet people in the community and answer questions. And yeah, I do usually have a booth there where I have some examples and we have those conversations, because a lot of people do have the same sort of questions. And it's nice to, the more you can spread awareness and education about something, kind of the less fear and uncertainty there is around certain subjects too, and to know the options you have in advance if you need to know that sort of stuff. I mean, we all do need to know, but yeah, it's a great event. I can't say enough about it apparently.
Well, and one of the videos that I watched too, you have to have a real awareness with what you do. I think it was one of your BRA Day event videos. Maybe I can't remember, but I do remember how much you talked about the knowledge that you have to have about compromised skin with cancer patients, either if it has to do with scarring, radiation,
I'm so sorry. Someone knocked at the door and my dogs are barking. I don't know if you can hear it,
Your
but
puppy is protecting you, so we're glad.
I'm like, of course, this is happening right now.
It's okay.
So yeah, basically, the challenges that sort of like face what I've spoken about in some events, like some talks in the past, is the challenges that face the nipple tattoo industry, and generally the challenge in general is getting the awareness out, having people know that it even exists, and knowing the degree of specialization that the artist has in tattooing in general, and also in the type of tattooing. So there's some people that just get a tattoo machine and tattoo, but they aren't technically artists and they aren't technically tattoo artists. And why I mention this is because, as you said, it is really important to understand the level of sort of delicacy in the tissue and the compromised skin. It's not even regular tattooing. It is an advanced skill to have an awareness of what you're dealing with, whether it's like, you know, radiation, how it's going to heal, how long to wait before you tattoo, scarring. And these are all things that if you don't know what you're doing, you can create further damage. So I do have consultations with everybody that I tattoo in advance, whether it's sending some pictures or having a phone conversation. And it also does depend how long it's been since their last surgery. So those are all things to kind of consider in realizing how important this tattoo is. That you don't just kind of go anywhere to get this kind of tattoo. You need to be aware of who's doing it for you, because there is some extra knowledge that should be had. In addition to just respecting the experience of it, you know, the experience of the tattoo. And I really do put a fine point on that yes, the result is important, but the experience of getting it should be just as important, for sure. So I really do hold that as a big part of my tattooing.
Yeah, and your accountability. Well, I really appreciate the opportunity to interview you today. We're going to have all of your information available at the end of this video where folks can contact you, because I know that you travel sometimes to help patients out. So not specifically to the Vancouver area, correct?
Yes, yeah. So my
and I
main
know it's
location is
COVID, so
Vancouver. Yeah, I know. I try to kind of, yeah, like I like to take, you know, general information, because, oh, you know, this will hopefully be over soon. Yeah, my main location is Vancouver, but I am always, there's parts on my site that you can suggest a location for me to go to.
So Candice, again, thank you so much for being here today, and give your puppy a little love for us. Puppy in the background.
Thank you so much.
We're all recording from home. I'll be sure to put all of your information at the end of the video. And thank you so much for joining us today. And also thank you for what you're doing for breast cancer patients.
Thank you so much for having me. I really appreciate it.
Absolutely. Take care.